And then when I was leaving, I was That version that you found has it. Yep.
Wait, is this public health?
All of them?
Do you know if they have?
Today's the deadline. So I believe that yes. Hi Sarah. Hey Sarah.
Yeah.
Did the CBOE decisions go out finally, like the final ones?
I don't know if they went out, but yesterday was the final decisions. And Mark is, I think all the STIP stuff should be,
Did it say public health in the?
the notice of determinations need to be going out
I think it is.
by the
Yes, on the
next,
revenue.
It looks right too.
5 business days, Sarah? So I'm not sure, they should be out by
No.
What?
Tuesday?
Okay, thank you.
Okay, you can sit up here, Janine, if you want.
Hi.
Okay.
To officially open and everything?
No, yeah, we can just jump right in
Okay,
with
well,
you.
Julie's here too, who's the real expert on the detail. So this is the public health. And just a reminder, public health is separate than the senior center and blood lead budget. And oh, 25, 26, 27 have not been finished.
Updated
So
I was wondering why.
with the transfers in and everything else.
yeah.
Okay. Is we can talk about 24's budget?
Yes. We anticipate, there's an increase grants, contributions, potentially doing more work around prevention, and taking advantage of some, prevention funding available at CDPHE. Asking for a transfer in, from the county. I think those are the two big highlights for 24. Pretty much same funding cycles, same revenue sources. There's, just in general, there's a lot of funding out there, but it doesn't always fit what we need. We go down to the, oh, sorry, go to the next one. I have it.
And the transfer in from, was this year the 100,000 and then the 24, 200? Yeah, okay. Okay.
Short-term goals. Getting new director hired and onboarded, environmental health, which we've had progress on. We've, made an offer. Do you have a start date?
Monday.
Ooh. Hey.
For
And-
both environmental health and a part-time administrative assistant.
So, with Kelsey taking on the deputy director position, the state highly recommended that there be additional environmental health support. Kelsey is still trained and certified and can do some of that, but they need an on-the-ground person. So this person will get on and become, it's like a year process to get fully.
She could be independent within like 5 to 6 months, so that's what I'm hoping for.
The other addition we added was a part-time administrative assistant because staff were having to cover the front desk whenever the full-time person was not there, and so that was pulling clinical staff and deputy director and finance person away from their other duties, so part-time admin assistant is going. We have advertised for family planning clinical staff and have a fairly strong candidate for that would probably take a little bit of arranging and maybe some collaboration with Summit Community Care Clinic. Have not had candidates for the immunization nurse that would fit, but that posting continues to be out there. And then we're also sort of evaluating what are the options with Summit Community Care Clinic and their ability to do full service primary care, and they will expand. They're 1 day a week right now, planning to go to 2 in January, and have been very happy with being there and feel like it's really serving folks well. So they could potentially be looking at additional days of service. I don't want to put for sure a timeline on it, but they're also going to begin their 2 days of behavioral health shortly at that location. So
Great.
It's really exciting. I will say the Leadville residents have just shared with them how happy they are to have them there. And their staff is happy to be there. Anything else you want to add about Summit?
I mean, yeah, they're great to work with. We really enjoy sharing the space with them. And the community people have been walking in throughout the week, asking if they're there. So we got more promotional materials to get more information out. And they will be able to see more patients in a day once we can get our internet like sufficiently upgraded. Cause it just doesn't support their IT needs.
And they even filmed like a fundraising video there at that location a week or two ago to
I
get
saw that.
contributions for this specific work.
Nice.
So I think
Nice.
they're doing development efforts. And they've had, I know they shared with us that they have had funders fund specifically this work too, since they announced it, so. Yeah, and just fabulous that they can serve that population, with who don't have insurance, if needed, so. And then the other option, or the other, goal is, expanding prevention services, looking to have a sexual health outreach and education person. And that's where we're hoping to maximize some of the CDPHE funding. And then also around suicide prevention and harm reduction. There's been a lot of activity with that. The harm reduction, the regional coordinator for this work has given us feedback that Lake County has been the most active of any that she's engaged with. She has done presentations. She's coming once a month to be available to do a mobile access in Lake County. We're looking at multiple locations that have Narcan available now, including the library. What others, were there additional sites? Sheriff's office. Community's very invested in this, so.
You say active, like participating or
Yes.
interested?
Coming to the
Like
training,
people
learning about it.
engaging.
Taking the Narcan, so public health has been distributing the Narcan, making it available to folks, and we've had quite a lot of interest in that. Which I would say with our population of folks in our community, it's gonna be really critical because tends to be a younger population, very kind of a close-knit group of folks. I mean, everybody kind of knows everybody in Lake County, and if you are actively using, you're probably going to be using around that group of folks and those friends. And so if they have access to some training, we've had several deaths that we think could have been prevented with this availability, so.
There's a senior population that's actually interested in learning about Narcan too, so, Taryn is hoping to give them some information as well and get them on board.
Taryn has done a great job at collaborating with Rochelle at the senior center and is looking at, including that group of folks. I think seniors, both for their own information, but also, I know a lot of seniors have concerns about like their grandchildren and wanting to be more aware and wanting to have information. Kids in college, CMC is also actively participating. Are they gonna be in our camp site too, somewhere on CMC campus? Okay.
I think the Cloud City High School.
Oh yeah, in Cloud City High School. So there is definitely a need for the outreach and education component of all of those, making sure we have ongoing supports. And suicide prevention, Sarah had the opportunity to kind of visit with the Eagle County folks who've done a lot of work in really focusing on suicide prevention, which starts from very early stages to law enforcement response, to behavioral health access, improving access within your community, but then also to what does hospitalization look like, and then what does post-hospitalization look like in your community? What do people come home to after being hospitalized, and what's that support system look like? And then the other big aspect of that is peer support. So how do we educate and train peers in the community? Because you're never going to have enough provider capacity in terms of clinical support, and not everyone is going to turn to clinical support, especially in their first responses. So that peer support and bystander support education is also a really important part of it. So we're really fortunate that Eagle County has been doing as much as they have, and they have shared that with us, so we kind of learn a little bit from what they've done. Long-term goals: have a fully staffed, highly effective, efficient public health agency focused on meeting key health outcomes. And I think a piece of that is also identifying what are the health outcomes that the Board of Health wants to focus on and measure and see results. Continue the partnership with Summit Community Care Clinic and ensure that that continues to grow, potentially, someday by 2027, they may be here every day. Having an active full-time staff dedicated to the unique needs of Lake County. And hopefully being able to make impact on things like reducing suicide and opiate overdose in our community. So,
can I did Jennifer Angst from CSU come and chat with you guys, or are you incorporating? Awesome. Okay, cool.
Yeah, and then we actually followed up with, local CSU folks too on some of the requests that we had were things like data collection, local data. And then also best practices. And then also just to know what else is working around the state.
Yeah.
What's happening, what's working, what are the mental health needs? What does that look like in rural communities?
Yeah. And then I wonder how, we've been having a lot of individual conversations with like new school board members, and as parents, it's like, okay, well, I know the question was, what do you want to see for the school? I'm like, I want to see the school not have to deal with a lot of behavioral health things that is happening because of like family breakdown or economic pressures that are, insecurity that are.
Yeah.
And does that weave in your heads into?
Yeah, I think more data collection could be valuable, because we need to know what exactly are those behavioral health issues? What are the youth in our schools today facing and addressing. We can tell you from the service provision perspective of dealing with folks in crisis, but that's what we see when it reaches a certain level. We would love to know how can, you work further upstream on that, but we are definitely seeing immigrant families and youth in those families I think that's another area that we can really address is having that fully functioning immigration resource piece that addresses behavioral health issues, folks coming with significant trauma.
Yeah, no, definitely, and though, like, I think of all the folks or families or parents who don't reach out because they're not, or they don't feel like they're in crisis.
Well, right.
Or don't
so-
realize that they're in crisis.
Yeah, so how do we,
And the other part of
Yeah.
that too is peer education for
Yeah.
youth,
yeah,
because they may talk to each other.
right,
And I will say, it's a generational, the norms are shifting and changing significantly, where youth today talk about anxiety and depression and have some awareness of that. So a lot of it is about being able to access services, which I think having more behavioral health providers with Care Clinic, and then also with another psychologist in town, those will make differences. But then the peer support is also really important. This is a breakout of the county contribution. So, looking at what's provided from other sources, and in each of these areas, what the county essentially contributes. Of course, the largest section being salaries. And Julie's been really good about helping to strategize where we're using money and where, and where we could apply more. A lot of the funding is still for COVID. And we're sort of like, we've done what we can, we are doing what we can, but a lot of that funding is still COVID specific. So we evaluate as opportunities come in, is this something that we could take advantage of? And just the other day, we were told you're getting more money coming in, and it can be used for outreach and education too. So, cool. All right, that's that one.
Stop sharing.
I stopped sharing this one, and then it'll give me other options.
Yeah.
So let me do, the senior center, and those are in here probably.
I only have what you sent me. Was that a spreadsheet?
Yeah, I'm wondering if I sent it,
It's not in there. I have it right here.
okay. Took me a little while to get used to the fact that the LCPHA budget doesn't include the senior center and Bloodlet. Oh yeah, I finished everything, I'd be so excited, I'm like, oh yeah, there's still 2 more to do, so.
Oh, no, it's in there.
Bloodlet, sorry, here it is,
Or senior? Scroll down. Here
Okay.
it is.
Just high level overview, and this one does have long range in here too. Biggest expense at senior centers is salaries. We were able to get some salary adjustments done, which were one of the first things she asked for when she got there. We have been paying below or at federal minimum wage. So increase that for one of our part-time staff, and the other part-time staff member, we needed to match our county portion, needed to match the UCOG rate. that the person was getting, so we were able to adjust that, get that taken care of. And any other highlights you wanna talk about from Rochelle's?
Just that she's doing a lot of outreach and trying to find out what the needs of the seniors are so that she can get more programs on board or more and different lunch and learns so that they can continue to grow as, you know, she's trying to expand the normal people that are in there and grow it. So it's not just the same group that, you know, senior encompasses a whole different demographic, including them as well. She's just trying to get a lot more things on board.
And there hasn't been really a training budget for the senior center staff, so she wanted to focus on that as well so that they could learn more to really elevate and grow our programs, and work with close communities to see what their senior centers are doing and see if we can do.
She's doing like a national conference, which she's really excited about, so we did have more in the training this year too. And then also hiring another part-time fill-in person, I forgot that, and mentioning salaries too, so when the two people that are there need to be gone, they don't have to close down if something can't be finished, so, yeah. Any questions on the senior center?
Are there any like repairs or things to that building above and beyond to like regular maintenance?
The roof will need repair. I don't know what's going on downstairs, there might be something downstairs, but it's the black hole, so I don't know.
Yes, well put.
That must be maintenance and upkeep, and the roof is the next thing.
And then that garage, if it's staying or going.
And are we trying to put that in like A and P line items per department, or we haven't quite gotten there yet?
I have not gotten it yet, but that is a good addition.
Did I close Teams somehow?
Teams is eternal.
That's what I thought.
But yeah, go ahead and hit the carrot on the right-hand side of the taskbar. Down, carrot, whoop, left. Hot, cold, volcano, click it. And then click that, yep.
Oh, I must have minimized that, okay.
It is eternal.
And then how do I get to the other presentations?
So make it full. Go right in the middle.
Oh,
You have to play the hot cold game.
Alright.
Scroll up,
Don't X out.
scroll up,
I am,
or you're all the way up.
Yeah.
Go ahead and click on Teams on the left-hand side. The top,
oh,
yep, down, nope. Cold, left-hand nav bar,
yes.
hot, click. Awesome.
Ah,
And then scroll down to the 11-1 work session, or you can change the order. I learned that from Chad.
yeah, I could do by date. But I just saw the files that were there.
Yes, you have to go back into the
Packet?
Yep.
Thank you. Lead. The one expense under this is salary, predominantly. And Julie really has a good history in this, understanding what we've done. I think there's some decisions to think about structure going forward. I think the other thing that we've talked about too is what does the Board of Health, it is the Board of Health who would decide what focus and what data would you like around blood lead. So I would say if we can assess how much of an issue it is, that drives us to what efforts we need to, do we want a clinical person focusing 100% of their time on blood lead, is it that much of an issue? Or is it a percent of their time? What are we trying to impact with the work, with the testing and so forth? You know, what?
Well, it's programming that comes straight from the federal government, right? So like, we're kind of subject to some of the constraints around the trust and the relationship through like LCCHP for some of that work. So I think it would just warrant a bigger conversation with like Kyle and Linda in particular.
I think also that, do we have a good sense of like how much of an issue is blood lead in our community, you know, like how high are the levels, where are they high, what is driving that, what's the long-term impact of high levels, and are we seeing that as well?
I would say so. I mean, you have to have testing for like preschool and head start programs.
I think when Heidi talks about, she talks about wanting to do more testing and wanting to get out and do more. And if you don't have that testing, you don't have the data that you need. But what were you gonna say, Jeff?
Well, I mean, this is just like super anecdotal, like not data driven, but I just feel like there's been almost like a generational shift of awareness. Like, I just think like if you were here 15 or 20 years ago, like you knew that soil contamination and like contamination in homes was an issue. And I just feel like that, I just don't hear people talking about that as much as 10 or 15 years ago. So I guess I'm curious, I'm curious to, like, what data do we have, what data do we need to know if, I mean, did we do enough remediation that it's actually less of an issue now, or is it just that people aren't testing because they don't know they should be? Or, I don't know, that's a bit of a mishmash.
I mean, we have data, in our monthly reports that we turn in about how many kids we test each month, how many are elevated, breastfeeding and nursing moms.
Okay,
I mean, as a public health employee, I had a kid with elevated blood, like it's a very important service, that we offer, and Heidi does, she's in the schools, she's at Bright Start, she's at the center. The outreach is there, she goes to the manufactured home neighborhoods. So, I mean, I think it's an incredibly important program.
okay, yeah, no, I wasn't, I think I was wondering more whether we need to sort of re-educate. It may also be that like my kids got older, so I'm like just talking less with parents at the age that are getting tested.
I would say as a parent of 2 kids under the age of 6, it's a topic of conversation.
Okay.
And I just recently did all the testing in the water at all the schools, and we had elevated levels of lead in the water at the schools, so, I think it's important to have someone dedicated to it.
So I think that's the thing, is this a primary health issue in Lake County that needs to be focused on and tackled? And if so, in what way? And if we are to tackle it, what are we doing? You know, like what measures are we trying to impact? Like, certainly the first would be higher numbers of testing, like trying to just get everybody tested, and that may take a more concerted effort. So it may need to be that, 75% of this person's time is focused on that. And if that data comes back, then what? So, and I think that's the question is, remediation is a huge, and then that gets the question of whose responsibility is it, and what do we spend our funding, and what do we spend our money on, or are there things that you can do if you can't change the environment necessarily, are there hygiene or health practices that you can implement that impact that? And if that's the awareness campaign, and where is it coming from? So that's the other thing too. Is it soil? Is it where is it coming from? Because that's where you want to target your education.
Childcare.
Yeah.
Do we have enough data do we know the answer to those questions?
A lot of that is in the things that she teaches, that it's like the handouts that I see her give it's in your paint if your house is older than this, it's in the dirt if your kids are playing in the dirt, or if they have pets that they roll around with and then they bring in the things. And she says how to wet mop your home, like she doesn't just do the testing, she talks to them about that and how to clear it up and how it could develop, delay the child developmentally, just different things I hear her when she talks, to the families and like that. I don't hear her at the schools or things like that. And then during Bloodlet week and stuff, she sends out little bursts and has things on display and different stuff. But right now, I think it's just she is pretty much maxed out because she's doing family planning, all the immunizations and the bloodlet. So it's one person doing 3 jobs again. She's down to that, and momentarily she'll be the only one again. So it's kind of a lot of things to do with one person doing it.
If we were to focus on this, I think it would need to be a concerted effort, and we have the personnel behind it to do it. Because she is doing what she can, I think you could up testing if you have the focus personnel, and you had the fund. So do you allocate a percentage of the fund to community education? I mean, it's good that Heidi's educating people. Do you need to do some public messaging? Do you need to, what does that really look like? And then what are we trying to impact with that?
Is that something that the Summit Care Clinic also covers?
They'll do testing,
Yeah.
but did they even say they do, they don't even do blood testing?
Oh, really?
It's a Leadville thing.
We're totally the super fun side.
So that's.
Well, I think that that's where the trust comes from, right? It's recognized nationally as one of the limited sites where the EPA was like, oh, we need to have some.
Well, and I think what we're lacking locally is the support for remediation. So I get a lot of people reaching out asking about soil testing, and there's nowhere local to do that. And we don't have the support to help people remediate. And I feel like there was maybe more of a focus on that 10 years ago, and we've lost some of that.
And that would pretty much use the fund up, you could do that, but would that impact the most people? Is that the best, so
Yeah,
those are all the things.
through our experience in the last 7 years, there's definitely certain things we could talk about focusing on or limiting that support to, so it doesn't kind of get out of control.
What were you saying? I was just gonna say that when we were doing remediations, when there were kids that were elevated and then they found the source of them at the home, and they were doing those, there's a few places that had to be remediated more than once. And they said, and I don't know that I don't have word for word and I don't remember exactly, so don't take me true to this, except for I remember them saying, even if they redo it one more time, if it rains or after this next season, the ones above them, the soil will come down and do the same thing again.
Recontaminate.
The environmental factors just continue to be the same thing as it spreads the soil from up above, brings it down, and you get the same issue. That's why some of the places that were already, they went around putting lawns at houses and testing the soil back. I bet those ones could be retested at this point and they'll be high again.
Yeah, they'd be elevated, because they did a lot of work
They
at one
did.
point in time.
I remember.
Yeah.
That's good history, is that where you spend your effort, or do you do, other things?
Yeah.
In terms of.
Well, even at one time we talked about the other workers, like adults that are consistently messing with the soil, construction teams and stuff, just to have that data, test them, see what theirs is like. I mean, obviously they should be wearing their PP, but let's say they're the developers and they're people that are stirring things up, just to see what, the effects are. And then it never went anywhere. And just to give, painters and things like that, okay, this kind of information if you're coming across homes that have this. I mean, you always want them to, just like the real estate agents that are dealing with their, homes they're selling and stuff, but.
So I think on the horizon for public
just
health,
follow through or follow up on those, so that's only quick, it gets lost.
Well, I think it's a matter of, you know, what are the health priorities? What does the Board of Health wanna focus on? It seems there's resources out there. It's just a matter of, pinpointing that. And if we go through a slight shift in maybe Summit Care Clinic does more clinical work over the next, from here to 2027, then what does Lake County Public Health? And maybe their sole focus is community outreach and education on sexual health and suicide prevention and focus on blood lead, you know, I mean, and whatever that looks like. That's what the board and everyone else, do you have thoughts or anything else to add on that?
No, I think we just, you know, we'd like to know what the priorities are from the Board of Health to support the long-term planning. And we have some big decisions coming up in regards to being a Title X clinic, because the Summit Community Care Clinic is also a Title X clinic. This doesn't have anything to do with blood lead. But you can't have two Title X clinics operating in the same building. And since we can't pay competitively, we can't really hire clinical staff. They can make almost double working somewhere else. So it's hard to recruit and retain folks. So what is the future, you know?
And Title X is family planning.
Yeah.
I have a Board of Health meeting next week, so all of these are on the agenda as well.
And then, you know, if you hire a director, it'll be that, you know, that vision too that will come. You find that thought?
On the lead, I mean, like, I don't know how to answer those questions you were asking about, like prioritization. Is that something I can CDPHE or, you know, and or EPA help us sort of like, work through those questions? Or, I mean, is that something we can do? And it doesn't feel like we have enough staff capacity to work through that kind of, I don't know if it's like data crunching or like, I mean, I don't know what kind of analysis needs to be done to answer some of those questions about like how you prioritize a lead strategy. So
And
I just feel like we would need some external
Yeah,
help.
so I have a meeting with Linda and Kyle before the
Okay,
7th, and then we'll see if they can join on the 7th to maybe answer some of your questions, or if you guys wanna pull your questions together or have a Board of Health or Commissioners work session, we can do that. Cause I think we have staff's perspective on like what works and what doesn't work right now,
okay,
and then what could be better, right? So we've talked about mapping in the past of where remediation has been done or where testing is high. Really what is our capacity, what can we do? And where do we know from current work being done, what is working the best for the community?
yeah,
Well, I think to Julie's point too, like, I feel like we've kept up on the testing, but with some hiccups on like big projects or wrapping up some bigger projects, we kind of lost the ability to talk about actually applying the funding and the resources to remediation at other levels. And some of the few cases that we have had in the past were lowered or didn't stick with the program, and didn't stick with testing. So I do think that it's, you know, getting the entire family testing and finding those sources, and then Heidi or whoever needs that tool and a resource to be like, okay, now we can do, you know, this with it, which I think is what I was hearing you say, Julie. Like we can do the testing, but then we don't have like what to offer.
Well, what I do think we've been seeing, and we have numbers to back this up, is we're not seeing as many kids at those crazy high levels. So the prevention approach that we've taken is working, right? And I think that we took that approach because we found that that's where we can have the most impact.
Yeah.
Because when we had like that laser gun that tested the paint, like didn't work right, and it was actually just created more of a problem than it was actually worth. And if we actually focus on repairing any paint that's chipping, or washing hands when coming inside after playing, and getting the right diet and all these things, that's actually the most effective way to prevent our children from having elevated levels. So I think that's how we ended up here, right? But we are obviously missing some things, but I think
Even
that's,
that candy, like when you see it at the stores when you do inspections and stuff, just acknowledging like that Mexican candy that has that iron in it. And when people went out of town or something and they tried, I can't remember if it was like makeup, certain makeups, like play makeup or something had a lot of iron in it, and kids were getting elevated levels from that, whether it was from Halloween or whatever they were doing, but that had it in it. So lots of little things come back, you don't expect it, and it's like, oh, but
Well, to Kelsey's point, does prevention, maybe where you wanna put your resources instead, I mean, the remediation is, you can have a little impact maybe, but maybe not over the long haul, cause it may just come back around versus everybody get on a prevention focus and you monitor that over time and you see if that's, you know, the best.
And one thing with the money we were pulling out for contingency and remediation, we were pulling out 5,000 for I think remediation, 20 for contingency. And we didn't really have a contingency that we were using, and 5,000 in remediation is not covering anything.
So your
it's like,
recommendation
I
was
kind
to
of
leave
wanted
it.
to leave it in the fund and earn interest or whatever, then, I was like, why are we continually pulling this out and we're not using it? It doesn't go towards our budget. So it was kind of almost like, no, it's not an overflow, we need to budget properly in the categories we need. So I don't know why we have to continually still put things in those two categories if we're not gonna use them properly until we decide what we need them for. I don't know.
And we lowered it,
And it was lowered significantly, we used to put a
So,
lot more,
yeah,
because we used to reward people for bringing their children in to get blood tested by paying $10,000 to $20,000 in gift cards a year, with the fund. But we've made it part of their preventive health, just like vaccines or anything else, and people are okay with that, they're not coming saying, I'll do it if you give me a grocery card, you know, or something like that, so it's.
right. We've tried a lot of things, so I don't wanna go over time, what's like, Liz,
Yeah.
we over time?
Yes, we are, because we have a special meeting at 10. No, the special meeting's at 10. But if the commissioners are all right with it, I mean, this discussion will continue next week at the
Okay.
Board of Health.
Yep.
And then we can move on to the Human Services budget for 24 in the long range plans.
But I just wanna make, I mean, I really appreciate you saying like you need direction from Board of Health, but like I feel like I need suggestions and like budgets, like, you know, so I mean, I'm just not a public health expert, so I don't know, I don't know that I'm magically gonna be able to come up with a lot of clear direction without some options on the table, so I mean, I sort of feel like I give you full reign to come up with ideas and bring them to us, you know, about what you think the priorities are.
Well, and I think if we're gonna talk about this at the Board of
Yeah.
Health, we need to at least reach out to Kyle and Linda
We've already
When did I
done
know?
that.
Yeah.
to come to the Board of Health.
Yeah, Liz is doing that right now.
When
Okay,
is
so
it?
you did it now, or you already did it?
We just did it now because I was gonna meet with them before them. But given your interest, we'll see if they can come to the Board of Health.
Okay.
When,
The Board of Health is on the 7th.
when was our?
There's not an agenda yet.
So I've reached out to all the people on the Board of Health asking for agenda items, and it looks right now, we're gonna talk about bloodletting, clinical staff for public health, WIC programs, and then an update on the director search. So if there's additional items y'all would like on that agenda, just let me know and I will work on getting it drafted for next week.
I would like to ask Kyle and Linda if they wanna take advantage and kinda incorporate some LCCHP
Like at the same time?
topics at the same time, cause
Yeah.
we've kind of punted the
October
discussions
meeting?
about the institutional controls and the OUs.
Yeah,
So maybe we can kind of combine those.
Well, I think your feedback is good. I hear what you're saying is that you'd like to, you know, with the professionals' feedback, but also have some proposals put forward about what we'd like to do with that. Okay, cool.
That'll work.
Thank you.
all.
Thanks Julie, thanks Kelsey. I know.
As you can see, they're the real experts.
Of it all.
Expert might be a strong word.
You're doing a good job.
Yes, very good job.
Thank you. Thanks.
Kelsey.
Snakes. Or snakes.
Should be
No
good.
snakes.
Should be
You're not
good.
snakes.
Oh, right, right, that's right. Thank you.
And so you're Julie?
You
Yeah,
might
this
I
is
think
it.
I've you a couple times.
You might have to
at my-
reshare your screen
Good, how are you?
with Zoom.
Oh.
Is it,
Oh, of course.
I don't know if it's shared because the meeting control,
You're
oh yeah,
right,
you do
yeah.
have to
I
reshare.
thought you'd come back Tanner with braided hair.
And then you should be able to just click on it up there.
How disappointed
I
is
think
it?
Yeah.
I didn't
Yeah.
get to get my haircut before I left.
There you
It was
go.
supposed to happen, so I
And then
couldn't.
It gets a little like wonky
And then Tina's trying
sometimes.
to.
Whether it lets you go to full screen.
Yeah, yeah, you should be able to click on that little icon down at the bottom.
Perfect.
Oh, that was the old one.
That's weird.
Not it, that was weird.
You weren't even in that PowerPoint. You're all the way at the end. There we go.
And is it sharing that now, I guess?
Yeah, I think so.
How do I get this to go to?
If you click on that little icon down on the bottom, right there, yeah, that one should, okay, now you should be good.
Thank you very much.
Yeah.
Alright. Should we wait for Jeff, or should we just jump in?
I think,
You
do
can
you wanna
start
just
looking
jump
at
in
this.
since we have that meeting at 10?
Yeah.
Yes, please.
Okay.
So, of course, primary, source of funding for the Department of Human Services is state and federal funding, which constitutes most of our intergovernmental. The area that's growing is grant funding, in addition to our allocations.
Are your allocations referenced in the,
I'll share that.
intergovernmental line item in
Yeah,
there?
yeah.
Okay, okay.
Yeah, they are.
And does that include SNAP benefits too?
It does not.
Okay.
This does not include the, well, let's break it out down here, let's see. Yeah, we don't have, to look and see if the services include, no, the services doesn't include that. Yes, sorry, sorry.
And that's kind of that's because of the, like, we don't actually touch
Right.
those dollars.
It's
They come
pass-through.
direct
Right.
from the federal government.
And the last spreadsheet I'll show shows, has that spell broken
Okay.
out.
Is training built into your allocations?
Mm-hmm,
Okay,
mm-hmm.
all right.
All right, so, short-term goals, ensuring staffing capacity. We've got, a couple of positions that we're trying to hire for. One is an eligibility technician position, which we fully appreciate support for having that additional position. We're trying to still find the right candidate for that. Recognizing that there's a desire to do more outreach, with SNAP in the community. And literally, like, we could use that technician right now before this outreach even happens. We are so swamped with applications and redeterminations with Medicaid. We, for the first time ever, have a backlog. And it's very stressful for staff because they're not used to having a backlog. They're used to being all caught up. It's across the state, it's across the country, but
Is that because of pandemic era
Medicaid.
benefits lapsing? Okay.
Medicaid, it's been a really, really, like, not only it's Medicaid, but it's also just the highest caseload ever.
Yeah,
So, and then lots of complications with Medicaid, like with people's Medicaid, it's just,
okay.
And what I hope to do as we talk about the SNAP outreach and others, if you all would like, I could do an update in one of our, we do quarterly reports to you, but I could have our staff, even in a work session, give you an update on how that's all going and just what that looks like in our local community, if you'd like some of that information, like what our numbers are in terms of backlog and applications and what that's looked like for workload.
That'll be helpful for me. I just feel like I'm not familiar with, how that workflow goes.
Well, I'll tell you the thing that's really happening and where the rubber's hitting the road is that it's taking a long time for us to get applications processed right now. And people are used to getting their applications done quickly in Lake County, but we're also, in some cases, that backlog causes us to be past the window that we're able to get, it could take somebody 2 months now to get their application through. And people are in crisis and it's been tough for them, and it's been especially hard for our frontline staff who have to keep telling people over and over again, and literally sometimes these people come every day to check. And they just don't have nothing they can do for them. So that's been really challenging. In other areas, our interpreter network is continuing, doing well. We hope very soon to have a candidate for our interpret network coordinator, and we'll be really getting that rolling. We are continuing to train interpreters, and what we're really finding in our language access is we're using Language Link for language access, and it's not nearly as effective as that in-person interpreter. So we're really working hard to have that as effective as possible, especially in things like child welfare cases and even child support, for example. We are also launching the Medicaid Member Experience Advisory Council. That will be starting in the next, we hope to have the first meetings early December. We have a consultant coming in to meet with Spanish-speaking folks who have either at some point ever applied for Medicaid, been denied from Medicaid, been on Medicaid, no longer on Medicaid, currently on Medicaid, that whole range of folks. And she is a Spanish-speaking consultant who has expertise in focus group and data collection, and will be evaluating that whole experience. Our goal by the end of that is to have worked with about 60 Spanish-speaking Medicaid, connection folks by the end of that grant cycle. We are also in our language access grant, with the Interpreter Network, we are doing intensive survey work on the experience of our Spanish-speaking community in interacting with the Department of Human Services as a whole, focusing on language. So do people know that we have interpretation available? How has that worked for them in the past, specifically on that? The other area we're working on is to, in responding to abuse and neglect, building the community partnerships. We're really trying to strengthen our relationship with the Sheriff's Office. We've had a lot of cases that we have co-investigated, and we'd like to continue to build that relationship, as well as bringing resources to Lake County. We're very excited to have Dr. Courtney Russell will be by the end of November in Lake County practicing, and we'll be able to do assessments, which we don't have a psychologist locally to do assessments. She will be able to do a number of a service array, including play therapy, which we don't have access to right now. So we're hoping to, and we're gonna write a TANF contract with her. So we'll have blocks of time available before she gets too busy, hopefully. Keep her busy with that. Long term, the larger picture that we're working on, as you all have directed, to focus on sort of the housing needs and how we can work on deferred maintenance. That's been launched, and that's our vulnerable adult grant work is actively happening. We have a first client that they're working with. And I think they're really looking at all creative solutions on those cases, so. Continuing to do our incentive funding and build resiliency for our staff. We've done a lot of coaching and public assistance this last year with the stressors that they're dealing with. And just the fact that it's hard if you're also experiencing some of those stresses in your own life, and then the people that are coming to you every day are needing help and supports with some of those similar situations, just helping people process that. So we're continuing to work on the incentive work, and that is also a grant-funded project for coaching. And then continuing to go this interpreter network. We're very excited. One of the aspects of the grant project is that we're gonna have consultants come in and develop a strategic plan for the interpreter network and let us know what are the options and what's the best direction for this. Should it be under the county? Should it be its own nonprofit? Should it be, what would be the most viable and successful direction for this? So we're excited, and we have a pretty good consultant, hopefully in the works, to come in and do that. So. And then this is, the breakout. So what you see here is the specific programming and the amount that the county contributes to each of those program lines. The miscellaneous revenue at the top is grant funding, and that continues to grow. Like, we keep adding, every time I do this, there's additional funding. One of the things that we have in the work is an application for Chaffey and Lake County as a regional HUD grant for youth homelessness. And that, if we get it, which we likely will because they begged us to apply for it, is $100,000 a year over the next 3 years for youth homeless work. That's not even on there, so we didn't calculate that yet.
And would that fit in with wraparound services?
It would be in wraparound. It would provide funding for host home families, for all those families that are providing services for those unaccompanied minors. It could help those families.
Okay.
And then the proposal also included a youth drop-in center for homeless youth. It could be for any youth, but particularly, and those youth that are living with other families, having a space for them to be and hang out. And, if you're couch surfing, you've got real space that's your own, and just, place to socialize and so forth.
Okay.
And staff for that. Trending, we see pretty much across the board, same level of funding, which I'm really happy with for child welfare. We saw a big boost. We were down to $425,000 a year allocation in child welfare at our lowest point. Now we're back up to the mid-60s, which is good.
Have you seen an increase?
Yeah, we have a very high, this week we've had like 4 or 5 referrals a day. It's just been.
Wow, that's a lot.
And their staff are we have a child welfare intake caseworker position also advertised, so we're really hoping to get that filled because we are pulling Anthony some away from the child welfare as he's doing this vulnerable adult, so he's having to do both right now, but some fairly intense cases. And just real busy, so. And then APS, we have 5 APS cases right now, so.
That's a lot, kind of.
It is a lot. We typically have, a
Maybe
couple.
one?
Yeah. So those are kind of the funding trends across the board. We're waiting to see what's gonna happen with childcare funding. And if CCAP is gonna get moved out from under counties, with
To
the,
UPK?
with the UPK, right?
Yeah.
Right now, it's still with us, and we have a lot of CCAP funding, that child care assistance funding. So what I've done is, in order to build up our staffing, we've trained some of our staff to do CCAP applications and be CCAP navigators, so I can try to utilize a little more of that funding too. So we just have, 187,000 or so a year, and don't spend it all, but we keep getting more. It'd be nice if that could be more flexible than other than just paying for.
Do you have the ability to add any comments in the comment period for the UPK, poverty limits where they're trying to rewrite the rule? Did you get sent that email too?
I get those all the time.
Okay.
I can participate if you'd like me to.
Yeah, maybe you and I
Okay.
can connect on that, cause
Okay.
I didn't read through it fully, but I don't know if CCAP's included in that rulemaking for,
I have not spent a lot of time looking at it, but I can.
okay,
And I can reach out to folks who have, if you want me to. I mean,
Yeah.
Megan Birch in Ebo County has really been focused on the childcare stuff. And-
Okay.
and I think so.
maybe you and I can connect on
Yeah.
that then and just look through that together.
Yeah.
Okay,
Happy to do that. We continue to see, high utilization of all of the benefit programs in there. In the collaborative management program, we are seeing, we got an increase in funding and an increase in requirements with recent legislation passed this last year. They want collaborative management programs to be the place that all youth under age 12, or under age 13 really, so 10 to 12 is the population they're looking at, who have any criminal, what used to be criminal activity, they can no longer be criminal justice involved. So any youth under the age of 13 for anything but homicide is not supposed to go a criminal justice route. It is supposed to go to collaborative management programs.
that was a recent legislative change.
So that,
And the food assistance is the
Yeah.
SNAP pass-through,
Yeah.
the
yes, that's
estimated
not
SNAP
pass through
pass-through.
with an average around $1 million a year.
Okay,
Just thinking there was something else I wanted to highlight on. TANF, I included additional funding for us to purchase in there, and we can have a separate work session if you'd like. I've been talking with Tim and I want to present to him a TANF budget. Some of which, as you know, is TANF funding to C4. Other things we'd like to do is have a TANF contract with a local psychologist coming into town. And continue to do the additional supports that we've done in the past. But, and if we don't get some of the suicide prevention and other funding available right away through CDPHE, I do some of that initial work with some TANF funding.
okay. Do you have any data or, information on the youth mental health hotline? Or does that go through?
Are you talking about, there's the Colorado Crisis line, and you're talking about a specific one? I can check on that.
Okay, that'd be good.
Yeah.
Cause I think you can, like, youth can call and get up to like 3 free sessions or something like
Oh,
that.
are you talking about Colorado, or is that the Summit in Eagle County?
No, there's one at the state level, but I don't know.
Oh, the
Goes
Hope,
through the school
Yeah.
districts,
The Hope.
isn't it?
yeah, the Hope, yeah. I can
Okay.
get you more information on that too. It's the Hope, forget what it's called.
So I wasn't sure if it was through
My
you
Hope
or through the
Line,
school
yeah.
district or,
It's a
State
statewide
or-
initiative.
yeah. Okay.
I think, yeah, through telehealth.
Mhm.
Yeah.
Sorry, is that the one with the dedicated, like, common phone number, like, or?
I have to look
I
and
thought there was,
see,
like-
yeah, I could research it more. Actually, when they came from Eagle County, that was one of the things she talked about, is like, what are you promoting to people to call?
Mhm.
Are you promoting the statewide crisis line? Do you have your own local one going on now? And how is that working for people?
Mhm.
So Summit and Eagle, well, I think it was just Eagle, created their own
Yeah,
local
their own
crisis line. And then what happens after that, and then after that, and, what are all those steps and what needs to be looked at and improved in that whole array?
yeah. It would be good to have some data around that, just to know, like,
They've got it in Eagle County, and they have $160 million to
Yeah.
do it.
I know, that's crazy.
I know. Well, the first thing they did is increase providers. They increased by 50 more mental health providers in their community.
I don't remember where I saw an article on that just the other day.
Yeah, I think we should bring Erin back sometime to present to you all and talk about what they're doing in Eagle County. They have, huge dollars, and it is their marijuana tax dollars are going specifically to this.
Yeah,
And then their private foundation gave a lot of money. But they are kind of doing this work and laying it out and have lots of knowledge and expertise that we can tap into it to the degree that anybody who works in Eagle County can use those services. And we have families doing that.
Mhm.
yeah.
So,
That'd be awesome.
yeah.
I think if you could set that
And then
up, that'd be
Olivia's Hope
great.
is available for both Summit and Eagle County, and that's free therapy sessions.
Okay.
I was just gonna say we should include, the city in that kind of informational
Yes.
conversation.
That'd be awesome too. Yeah.
Yeah.
Okay.
Just so high level, the contribution of the county is about 483,000 before mitigation. And just remember that mitigation means anything that we overspend in our allocation.
Mhm.
If it's underspent across the state, we get mitigated, and so I usually can predict what that's gonna be. So in the end, it will probably be something like 7%. And then we are asking for contribution to the fund balance. We will not need our fund balance if this budget falls into place like it is. We didn't need it last year either. We didn't need to access. In fact, it actually grew because of our grant funding. But we'd like the board to consider adding to that fund balance this year to make sure there is enough there for any big emergencies should they happen. Unfortunately, we didn't have a federal shutdown, but
Yeah. Crisis averted for
anything else you want me to
Yeah.
add?
I had a question, you mentioned
Yes.
housing, and I wasn't sure maybe if it's in here or in a supplemental budget, we talked somewhere between, we started at like 600K, but maybe lower for like the more significant
Yeah.
renovations, is that coming?
That'll be a supplemental budget
Okay.
request.
Okay,
Janine and Emily have spoke, me and Emily have spoke, at C4.
Mhm.
So what, partnership with C4 could look like, and then what, like, some like targeted funding with DHS clients could look like as well.
okay,
It's coming.
okay.
It's not in
Okay.
here.
And then I was also, what is the LEAP funding?
Yeah, so LEAP that is pass-through dollars. That's the amount that gets provided to Lake County residents to pay low energy assistance programs, pay utilities and fuel sources. So Goodwill Industries out of El Paso County actually does all of those application processes, and C4 has been helping folks with application assistance as well as our staff. Our staff can do, we get a little bit of funding, we get $20,000 for our staff to help people get those applications in, and then if they get rejected, to help them get back through, because they're pretty cumbersome applications.
Okay, and that's separate than TANF funding that might go, okay.
That, and then, so what we provided was, and I'm sorry, Colorado Works is the same as TANF. So the TANF stuff that we're talking about is under that Colorado Works
Okay.
program. And we gave C4 additional TANF money to supplement for the utilities, yes.
Okay.
We're seeing an increase in people applying for OAP, which is what you can apply for while you're applying for disability. Getting onto disability can be a multi-year process, and so we're seeing more applications than ever of those. It's called old age pension. It's a horrible name. But that's what that is. Cool. I think, yeah. I should put TANF next to Colorado Works. Those are always synonymous and get confusing.
Thanks, Janine.
Mm-hmm.
Yeah, thank you. Great. Are we not doing public works and library?
We're having a special meeting, and then we're doing public works and library, and SAR, and county attorney.
Okay. Right. Thanks, Janine.
Long day.
Yeah. Thank you.
Yes.
No, thank you.
Nice.
Yeah.
Just
Thank you.
start,
Yeah.
start.
Candy.